Today we're getting under the hood of caregiving with Dr. Eboni January, widely known as Dr. EJ, a board-certified OB-GYN, surgeon, best-selling author, and nationally recognized leader in maternal health, preventative wellness, and healthcare equity. What has your caregiving journey been like?
It's been very humbling. It has taught me so much about myself. It's taught me patience. It has taught me a different form of leadership. It's one thing to be a leader in the exam room, in the operating room, or as a mentor, as a public health advocate, but it's another thing to lead caregivers who are caring for your dad or friends who are caring for your dad or your family member, your loved one. It has taught me a different level of balance because I teach balance all the time. I teach the 168 hours to hone in on your week to be a power woman, right? But it taught me a different level of balance when you have this sick loved one that whose needs that you sometimes have to put above your own. It's not like having a child who has to go to school or that you have to get dressed. This person is sick every single day. So it taught me the journey has been challenging, but it's been very, very, very rewarding. And I would not change it for the world.
What resources are available to help me manage daily caregiving tasks without burning out?
Actually, there are a lot for people out there that are looking for resources. I definitely encourage you to make sure that you check out the local area on aging. There are so many resources that are available to you. Now, you may have to sit on the phone for hours on end, but make sure that you check out your area on aging. There are so many resources. Google respite care, right? And whatever insurance that you have, see what respite care services are available to you. I encourage people to plan their household. That's very, very, very important. And know how to navigate your health system, your health plan. That was big for me. And I use tons of organizational tools, and that helped me to organize my life without burning out. I use even tools that I use in my business. I use them to carry over as, yeah, you had to. Like I had to run it like a business. Things like Trello I use in my business. I definitely use with my dad. I use dry erase. I have probably 5 dry erase boards, and I use them in my business. I use them for my dad as well. I use shared notes. I definitely use that for my dad's as well. I definitely use folders. I'm one of those people that even though I have it on my phone, I definitely have it in the folder as well, not just for myself, but anyone else that's taking care just from a continuity of care standpoint. So I definitely encourage people to understand what resources are available. That was something that I didn't um, necessarily because this was a different walk of life for me. And I was big on resources for my patients, making sure that they knew what resources were available to them. But when it came to caregiving, it was something that I had to learn what was available to me. But the area on aging and getting someone, there are people that actually know what their job is to know what resources are available to you in this particular walk of life. So make sure that you know someone, that you find someone that can tell you what resources are available.
How do I balance caring for my loved one with taking care of my own health and well being?
First, that was very, very difficult for me. Everything was about my dad, especially considering he's nonverbal and he also cannot walk, right? And he's incontinent. So everything I had to do for him or a caregiver has to do for him. So to me, he came first, right? In my mind. But the more and more it started wearing on me, I realized that I had to come first, that I was nothing to him if I was nothing, if I was just a shell of myself. So at one point, I realized that I was still going through life, that I was still, meeting challenges in my life. And especially when my mother passed and my aunt passed just a few months later, I realized in those moments that I had to get a handle on well-being, my mental well-being, my physical well-being. And so I'm actually ashamed to say that I didn't really realize how important it was to put me first until I lost my mom and my aunt. And so now what I do to put me first is when I see that he's safe, that he is dry, even if he's wet for a little bit, I make sure that I still meditate first. I meditate and I pray first, and I take those moments to myself first. The other things that is very important is that you can, especially if you have it, and most people do have respite care, pre-plan it, especially if you have vacation coming. Pre-plan your vacation, pre-plan your respite care, pre-plan care for him or your loved one. Those are things that you can pre-plan. Pre-plan your wellness. And it should always be in your schedule. But if you have those times where you're going to, have a wellness day, make sure you pre-plan those and pre-plan the care that you have, but always integrate it into your daily day activities. But the first thing that you have to do is wrap your mind around the fact that you come first. We talked about this the other day when we talk about what they tell you on the plane is to put your mask on first. You definitely have to put your mask on first. And so that is what's most important. And unfortunately, I learned it, I felt like a little bit after the fact.
What financial support, insurance coverage, or government benefits can I access for caregiving?
The one thing that's really important is that I'm a doctor, but I'm still human, right? And so I think that you should make sure that you capitalize on every financial benefit that is available to you, whether it is any insurance benefit. Veterans actually have access to tons of benefits. FMLA, make sure you have access. I am actually self-employed, so I have disability. I have not utilized it yet, but disability insurance, and as you age, and this is a little tidbit that you should take advantage of, and maybe that you should get if you have that if you have resources, if you have the ability to do so, is long-term care insurance. If you're able to get long-term care insurance, this is something that you should absolutely utilize. Hospital benefit, that's an insurance that many people don't necessarily take advantage of. If you are hospitalized, there are certain insurances that will pay for you when you go into the hospital, or if your loved one's in the hospital, that they're able to pay for. So those are some things that are that you should take advantage of. But make sure that you take advantage of every single benefit that is available to you.
How do I navigate difficult conversations with my loved one about independence, safety, or end of life care?
My dad, although he's nonverbal, he understands. The first thing that I make sure when I address him is that I make sure that I show genuine concern, right? Concern for his feelings, that I understand where he's coming from. So it's an acronym that I use, and that's CAMP, right? C is for concern, that I am concerned for his well-being, his safety. That I acknowledge that he wants to be independent. I acknowledge that I know that you want to be independent. I know that this is a frustrating situation for you. And M is for meeting in the middle. Like, we have to meet in the middle no matter what decision we have to make. And then P is patience, because, you know, as people age, they're going to forget, and we're going to have to address this all over again, no matter what the conversation is. And so I use that acronym and that's CAMP, to care, right? And to show concern. A, acknowledge how they feel and that they're frustrated. M is to meet in the middle, and P, to be patient, because it can be frustrating for you, frustrating for them, and then you're going to have to revisit this all over again, especially if they're showing signs of dementia and forgetfulness.
What legal documents like power of attorney, advance directives, wills should
Yes.
we have in place?
So you should definitely have healthcare power of attorneys in place. Everyone is going to ask for your healthcare power of attorney before you can make any decision. They're going to ask, you need to have it on hand, whether it's in your phone, in the email. They're going to ask for it over and over and over again. You'll definitely need a financial power of attorney as well. If something were to happen and you need to have access to their bank account, things of that nature, or their social security, you're going to need that. HIPAA, you're going to need those HIPAA release forms, advanced directives. That's something that you'll actually need. In some scenarios, a will as well, which is nice to have, but those are some of the main documents that you'll absolutely need to have.
How do I recognize signs that my loved one's condition is changing or worsening? And when should I seek medical help?
Some of the signs is if they're not eating, or if they're eating less, if they're not drinking as much as they used to, if their mood has changed, if they're more irritable or anxious, those are some of the signs. And usually, if your gut is telling you that they're not the same, then you should probably call 911.
What are the best ways to manage medications, treatments, and doctor's appointments effectively?
Some of the things that I always say is just make it easy for you. You're not just managing your life, you're managing their life as well. So put things on subscription. What I try and do is I try and get people involved, get the pharmacists involved to make sure that you kind of batch refill, get the doctor's offices involved, put timers on your phone, set alarms, keep track, not just on your phone, but actually have a document where you can keep track that everyone can see. My dad, for example, he's on hospice, so and make sure that the hospice nurse can see when he needs a refill, and that the date, the dose, and the actual the week as well when it needs to be refilled is very clearly visible. So make sure that you make it easy for you just by setting timers, and that you're getting other people involved as well. Because, with me, we talked about this, is that I lack sleep all the time because just of my dad's condition. So sometimes you forget. So make it easy for you by just setting timers, setting alarms, and getting other people involved.
Where can I find emotional support or community, support groups, therapy, peer connections for caregivers?
NamiMD.org, Alzheimer's Association, Caregiver Action Network. You can sign up for so many different organizations, and they'll make sure that they keep in the loop. They'll make sure that even caregiver.com, they'll make sure that they reach out to check in on you. You'll get a newsletter. They'll give you tips on, make sure that you're checking in on yourself as well.
How do I deal with family dynamics, sharing responsibilities, disagreements, or lack of support?
No, this is tough. You can't make people support, right? But I have been really, really blessed in that I have friends who have become family, and they have stepped in and really, really, really helped me with my father. I cannot express enough how rich in friendship that I am. Friends who have changed my dad's diaper, friends who have come in and when I've been out of town and stepped in to check on my father. And I just cannot express that enough. So oftentimes family comes in a different form than what you're used to, and you'll be shocked. And so when those people, oftentimes I always tell people you can't make a square fit into a circle, right? And so when you can't get family to chip in, sometimes those friends are going to step in. And so I've been blessed in that regard. And that's what I'll say. Just look to unique forms of support.
What respite care options exist so I can take breaks and recharge without feeling guilty?
This was actually something that I didn't know existed, but I'm glad that it does. You have in-home respite. You actually have short-term respite where, depending on your insurance, you might have 5 days where you can get respite as well. And then there are different organizations where you can get respite. And then there are also some people who will just volunteer to sit with a loved one as well.
What are your top 3 tips for caregivers?
Document everything. You want to make sure that you have your list of medications for them. You want to make sure that you have their insurance readily available. You want to make sure that you have their diagnosis readily available. You want to make sure you have that in the binder on your phone, have it readily available. Make sure that you also have a hospital bag that's readily available as well. So you want to make sure that is pre-planned, and you also want to make sure that you know what benefits are available to your loved one. I cannot express this enough. Know what is available for your loved one.